Hi everyone, my name's Nick Birch and I'm a physical therapist here at Physical Therapy First. Today we're in our location in Clarksville and I'm also available at our location in Rosedale. So baseball season's just underway, our Orioles are looking good, so I figured it'd be a great time to talk about shoulder pathology and how to diagnose whether or not you have tightness in your throwing shoulder. Okay, so just a quick, easy way that you could look at your own shoulder range of motion is you could just lie on your side with your throwing shoulder underneath. So Alex here will be our patient. So as you can see, Alex is right-handed, so he's laying on his right side. So right here, with his elbow sticking straight out away from his body, you can see that this is a neutral range of motion for the shoulder. And if we take his shoulder down, this is what's called internal rotation of the shoulder. And as you can see, I'm getting an end feel right there. So Alex is significantly tight into internal rotation of his shoulder. So normal range of motion would be that his palm is touching flat to that table. And now looking in the opposite direction, this is external rotation. And as you can see, Alex has full external range of motion in his shoulder. So a good thing for Alex to do in order to normalize the range of motion in his shoulder and prevent any injuries that could occur from throwing, he should do some internal rotation stretches. So while in this position, once you determine which one's tight, so for Alex he wants to stretch down into internal rotation, you can take his other hand here and press down just until you feel a comfortable stretch there in the shoulder. So again, this is an internal rotation stretch. I usually tell patients to hold for about 30 seconds and do 3 to 4 repetitions each time. So if for you, you are the opposite, if you happen to be very tight, going the opposite way, you could actually just stretch the other way, and again, you could just use your hand and press down, holding until you feel a decent stretch, but not any pain in the shoulder. So again, with any type of stretching, you never want to stretch too far to where you're having any sharp pain, but hold down hard enough so that you feel a comfortable stretch. Again, about 3 repetitions for 30 seconds, you should really see some good results and have less pain while throwing. Okay, so once you have your shoulder well stretched, there's a few exercises you can do to help strengthen your rotator cuff, which again should help prevent any pain in the shoulder while throwing. A lot of people do exercises in the gym for the other larger muscles in your shoulder, such as your biceps, triceps, trapezius. Not a lot of people spend time strengthening the rotator cuff, and it can often lead to some pain in the shoulder. So 2 simple exercises you can do. If you have a therapy band, you can put a towel underneath your elbow like that. You want your elbow at about 90 degrees, and you're going to keep it there the whole time. So you're not going to bend or extend your elbow at all during this exercise. And the first one is for external rotation, so Alex is just going to pull the band straight across towards his body, just like that there. And again, you want to make sure your elbow is staying tight against the towel, and he's just pulling across, trying to control that movement the entire way back and forth. Okay, and then one other exercise that you can do, so we just talked about internal rotation strengthening, now we're going to do external rotation strengthening. So very simple, same exact position, towel in between the elbow and the body, elbow bent to 90 degrees, and you're just going to pull out away from your body, keeping that elbow in tight. And again, just trying to control that band all the way through the entire arc of motion. Okay, so we just talked about the 2 strengthening exercises for both internal and external rotation of the shoulder. Usually I'll have patients do about 3 sets of 15 to 20 repetitions for each one. And again, you should use a resistance that's about a medium difficulty. That's not too difficult for you to do, but also not too easy. So that's your PTF tip of the week. If you have any questions, feel free to log on to our website, physicaltherapyfirst.com, and have a great day.